Rehab without filters. Real pinch training with weak hand. Hi friends. Welcome back to another educational video with Dr. Rehab. In this video, you'll see a real moment from Rehab. A simple looking task, picking up and dropping small cubes. For some of my patients, even this feels nearly impossible at first. But we start early, with small tricks and guided support to help them take those first steps. It's not about perfection, it's about beginning. Stick around till the end to see how progress starts, exactly where it feels impossible. Real rehab begins right where you feel you can't move. If you found this helpful, don't forget to like the video. Got questions or thoughts? Drop a comment below. I'd love to hear from you. And hit subscribe for more real-life rehab moments and practical tips. Let's grow together, one small move at a time. We use 4cm wooden cubes to train pinch grip in a patient with low hand strength. Even though the patient could position the fingers around the cube, lifting it was a whole different challenge. Patient 1 is able to open the fingers sufficiently and position the cube between the thumb and index finger. However, due to limited strength, they are unable to carry the cube all the way to the container. It often slips and falls. We allow repeated attempts to encourage gradual improvement in coordination. Patient 2 presents with more severe movement limitations and lacks active pronation. To facilitate the task, we allowed them to use the unaffected hand to rotate the forearm passively, just enough to bring the thumb and index finger into a functional pinch position. This also helps offload the weight of the affected arm, providing support for weak shoulder muscles during the task. After several repetitions, some increased spasticity may occur. In such cases, gentle stretching between trials can help manage tone and maintain functional movement. Patient 3 has relatively stronger shoulder control and does not require forearm support. However, due to a thumb and palm deformity, performing a pinch is quite challenging. The patient initially attempted to complete the task independently using only the affected hand. Despite their effort, they were unable to achieve functional pinch. We then allowed them to use the unaffected hand to assist in positioning the thumb properly to enable the movement. Thumb spasticity interferes with releasing the object, but the patient still tries to release it voluntarily. When release is not successful, they use the unaffected hand to assist. Patient 4 has both significant hand weakness and very limited shoulder mobility. Since we initiate movement training early in our rehab approach, this was the patient's first exposure to the pinch task. To maximize stability and control, the patient was positioned very close to the table, with the forearm fully supported on the surface. We placed a cube directly on the table, and the patient worked to position it between the thumb and index finger. Initially, he practiced applying gentle pressure to attempt a pinch. Then, within his available range, he began sliding the cube across the table. After several attempts, he was able to move the object side to side, demonstrating meaningful engagement with the task. We gave him the time to explore and understand the movement, and to try out different possible strategies for performing the task. We occasionally provided assistance when needed, but ultimately, he achieved better movement, which was both encouraging and satisfying to see. Patient 5 has shoulder weakness, so we allowed him to support his affected arm from underneath during the task. He held the cube in his hand, and to facilitate release, he rotated the forearm into a supinated position. This adjustment made it significantly easier for him to let go of the object. Patient 6, Yasna, has been practicing this task for a while and has shown notable improvement in hand movements. At this stage, we combined object transfer with dexterity training. She was asked to rotate the cube in her hand during each transfer, challenging her fine motor control. Finally, we progressed to stacking the cubes, which tested her shoulder stability, hand coordination, and precision, all in one integrated task. Progress isn't just about strength. It's about mastering the small, precise moves that bring confidence back. You've just seen how hard my patients are working on their recovery. I'll definitely do my best to record and share their progress with you in the next videos. I hope you enjoyed this one, and thank you so much for watching. Thank you.